Okay. Good afternoon, everyone, and happy World Fertility Day. For those who are joining us for the first time now on Facebook, happy World Fertility Day. And today we've got talks for the entire day, every hour, and some at every half an hour as well. So now we've got Dr. Sulaiman Heylen. He's from Cape Fertility Clinic. Definitely someone that is very well known and I would say a favorite amongst the ladies. So that's doing fertility treatment. And we've got some great questions to speak to you about. And the title of today's talk is Treatments Available and How to Prepare. Doctor, thank you for joining us and always willing to do this for us. Maybe just want to give a quick background on where you're from and what it is you do.
Oh, okay. Thank you, Leanne, for the very, very kind invitation. It's a pleasure to help you. And I think this World Fertility Day is obviously very important for informing everyone around infertility and fertility treatment, because it's indeed something which is very important. It's not always very well understood. So I'm Belgian, born and bred in Belgium, studied in Belgium, came to South Africa to work as a very young doctor. I'm still young, but anyway, I got married to a lovely South African woman. 30 years later, I'm still here. So, yeah. I work at Cape Fertility Clinic now for the last 25 years. We've got a very great team there of doctors. There's Dr. Leroux, Dr. Matebese, Dr. Oosthuizen, and then our newest addition, Dr. Potau. Yes. And we are supported by very lovely staff, nursing staff, embryologists, accountants, ladies, PAs. Yeah, it's a very lovely place to work, a very happy place to work. Yeah. And we focus on fertility treatment, so we don't do anything else than helping, and I'm not going to say women, but couples to have a baby, or helping people to have a baby. So anybody who wants to have a baby or has got any type of fertility problem, we do our utmost best to help them with whatever we can. And obviously, people always think and speak about IVF, and IVF is a big thing, and it's the best thing. And I think we have done 11 this morning. So we had 11 ladies. I think we took out the eggs this morning, but so it's a very common thing, but it's not the only thing that we do. And we also do a lot of other treatments. And we also do what we call reproductive surgery, that we just try to fix things, so to make sure that women can conceive spontaneously without doing IVF.
Okay, so I think when we get into our questions, our first question would be, when would you be advised to undergo fertility treatments?
Yeah, that is actually the best answer to that is to go, what is the definition of infertility? Huh? If you look at the normal definition of the WHO definition of infertility is, if you're trying to conceive for 1 year and you have not been successful, then you're considered to have a fertility problem. Or in women above the age of 35, if it's 6 months, because women above the age of 35, their fertility becomes more of an issue, the time becomes more of an issue. And obviously it's dependent from person to person. We see sometimes couples that come to us, they've been trying to conceive for 10 years, and only then they decide to go and see somebody. Yeah. And then we've got other couples that are very proactive, or sometimes we've got single people that come in, they come for a checkup, they just want to know if they're fertile, yes or no, both men and women, which I think is very, very proactive. Is a very good thing to do. And so it depends from person to person. But then there are obviously signs. Huh? So sometimes there is a very good sign to say that, okay, I might have a fertility problem. And there are very obvious signs. And for a woman, it's very important to look at the menstrual cycle. So the menstrual cycle is probably the best indicator to say if there is a potential fertility problem, yes or no. So if a woman has got a normal regular cycle, she means she has a period every month, and she bleeds for 5-6 days and it's not painful and there is no bleeding in between and everything is very regular, that's a good sign. Okay,
Yeah.
that's a sign that not that she is fine, but it's definitely a good sign. What are warning signs, for instance, is excessive bleeding. So if you got every month very heavy periods, that's very heavy, you say, yeah, it is. Or severe pain during the period. So you've got every month severe pain that you have to stay home from work for a day or two. So you can't, you have to take not just a Panado to relieve you from the pain, but you have to take something strong. You have to take Myprodols 3 times per day for 2 or 3 days. That's a warning sign.
Yeah.
Or your period is very irregular. So if you have a period every month, that's an indication that very likely there is an ovulation, there is an egg coming out every month. Yeah. But if the period is very irregular, it means if the period is every 2 months or every 3 months or every 4 months or no period at all, that's a very good indication that there is something wrong with the ovulation. Yeah. So for women, the period is a very good tracker actually for what can be there for the fertility. And then there are obviously the general signs, and you must also look at your history. So both male and female infertility can be affected by something that happened in the past. I'll give an example, an infection. Yeah. And I'm not speaking about a simple thrush infection for women, but about a pelvic infection of the fallopian tubes and the ovaries. Or for a guy, when he had an infection of his testes. So when he say, okay, he had an infection of his testes where there was a swelling and the testis was red, it was pain, he had to go to the doctor and to take antibiotics. So these are warning signs that if something has happened in the past, that you might have a fertility problem. Or if you have had an accident for a man, for instance, can be, okay, he had an accident of his testis. I mean, and I'm not just speaking about a small sports injury, but I'm speaking about something serious. You had to go and see a doctor, and it was a problem, and maybe you were hospitalized for a day or two. Or for a man or a woman, if you had an operation in that region. So a man, if he had an operation from his testis or from his bladder, for instance, that can be an indication that might be a problem. So if he had an operation as a baby or as a young boy, that could be that there's an indication of a problem. Or for a woman, say, when she was 14 years old and she had a rupture of an ovarian cyst, for instance, and that can also be, and they had to take her to theater to fix that. And that can also be an indication that there might be something wrong. So medical and surgical histories can sometimes, in the ratio of the genitals, can sometimes be an indication that there can be, not always, but there can be a fertility problem. So these are warning signs. And if people are struggling to conceive and they have one of these warning signs, then they surely should consult a doctor, a fertility doctor, to see exactly what the diagnosis is and what can be done about that. So yes, fertility, if you have struggled to conceive for a year, general rule, okay, that's the time to see a fertility specialist.
Okay, how does your health, I'm actually going to skip that one because it says, how does your health impact your fertility before treatment? But I think we've just gone through that. Or is it something
Not really.
that you want to add? Oh, okay.
Or maybe yes.
Please go ahead.
But yes, we have, and yes, we haven't. Huh?
Okay.
Yes, certainly we have touched on that, but I think that's a very, very good question, actually, because especially for males, I always say that the testis is the most sensitive organ of the body.
Yeah.
So whatever you do will have the biggest effect on the testis. So a testis is an organ that produces millions of sperm cells every day. Huh? So it's a very active organ that works all the time. It's different from an ovary. An ovary doesn't produce eggs every day, but so anything that a guy does that has got a toxic influence on his body will have a toxic influence on his testis. So health impact, yes. I mean, if you work in a factory with heavy chemicals, or if you smoke, or if you have cannabis, if you use a lot of cannabis, I mean, if you have a very unhealthy diet, if you're overweight, all these things that are health general health issues that do have an impact on fertility. And it's important for both males and females. Huh? So it's not that it is only for the guys, it's also for the women. I can also give another example. For instance, if you do IVF on women that are overweight and are unhealthy and eat unhealthy food and don't do exercise, your chance of having a baby, your chance of being successful is half of somebody who is in good health. That's a huge difference. Huh? It's amazing. Huh? So if you look at 50% compared to 25%, it's like mind-blowing actually how big the impact is of general health on your fertility. And it's probably the general health is probably the biggest impact on fertility, more than on any other organ. Huh? So if you look, for instance, at heart or the colon or whatever, health has got always an impact for whatever. Eh? So everybody knows that you have to have a healthy lifestyle to prevent that you're going to have a heart attack. But on fertility, the impact is really major, and it's very important to have if you have a healthy lifestyle, then your fertility is much better. And then people always say to me, but I mean, my cousin, she's so much overweight and she smoked so much and she had 3 babies very easily. Yeah, but that is life. Eh? So you can also say, yes, my granny smoked all her life and she became 90 years old. And it doesn't mean anything. Eh? So there are always exceptions to the rule, but we know very clearly that general health has got an enormous impact on fertility. And that's the best thing that anybody can do to make sure that they are in optimal fertility, is look at their general health, to eat healthy, to exercise, and to make sure that you're not in contact with any toxicity in your body. Huh? So these are the things that are important. So yes, it's a very good question, and it's a question that we have to address every day with our patients.
Okay, and then the next question is, what is the first line of fertility treatments?
Well, I actually don't like to give a first line treatment. I like to make a diagnosis first.
Yeah.
When a couple comes for fertility treatment, then I like to see what's the problem. And then once we have the problem, then we make a diagnosis. So we know this is what the issue is, and we make a treatment. So I give an example. If a couple comes and we see that the tubes are blocked, then we must not give fertility drugs because it's not going to work. We must have a look at the tubes and see if we can unblock them, or we have to do IVF. Or if a couple comes to us and the husband has got a very low sperm count, and I'm going to give the wife fertility drugs, which is the first line treatment, is not going to happen. Huh? Because I think this is a very good question, because that is something that we see at the fertility clinic all the time. Huh? The first line of fertility treatment is very often considered tablets like Clomid. Huh?
Yeah.
We take tablets from the 30 until the 70 of the cycle. So we have got very often couples that come to us saying, doctor, I've been trying to conceive for 2 years. You know, we go through the history and say, yes, but I've been taking Clomid for 6 months already and nothing happened. Okay. We ask, have you done a sperm count? No, we haven't done a sperm count. Have you tested your fallopian tubes? No, we have not tested your fallopian tubes. So it's best to do these things first and to make sure that we are not going to waste a couple's time and money.
Yeah.
And I would like to give some exceptions on that, obviously, because if you come to us and there's a clear ovulation problem, say, okay, a woman, I give the typical example, polycystic ovaries. They're just married, okay, 2 months married. They're both young and say, okay, I've never had regular periods in my life. Ramona, as a teenager, I had irregular periods, and we diagnose polycystic ovaries. Then we can just give Clomid or something similar. And that's the first line treatment. And we don't have to go to the whole test because we know there's an obvious problem. We can treat the problem, and there's a very good chance it's going to work. But you've got somebody coming with a reasonable long history of infertility, and you don't know why. Then it's best to test the fallopian tubes, test the uterus, test the ovulation and test the husband, test the sperm, that we know everything is in order. And then we can see where is the problem, and then we can focus on the problem. And then we can give a first-line treatment for the problem. Okay. So the question what you're asking, what is the first fertility treatment, is we make a diagnosis first. And then there are different treatment options that we have. And very often we go to number 1, number 2, number 3. Number 1 is fertility drugs. Number 2 is intrauterine insemination or artificial insemination. And number 3 is IVF. Yeah. So these are the 3 levels of fertility treatment that we have. But then, let me repeat, we have to make a diagnosis first before we can go that, because sometimes we say, okay, the tubes are blocked, we can't fix them. Number 1, yeah. And number 2 is not possible. That's a common question that we have. Huh? So people contact us all the time and say, oh, doctor, I've been diagnosed with blocked fallopian tubes. I would like to do artificial insemination. It can't work, because for artificial insemination, you need open fallopian tubes.
Yeah.
If you have blocked fallopian tubes, you can do IVF, yes, but you cannot do artificial insemination. As a question that we have like virtually every day. Oh. So first line, second line, third line can be done, yes, if the indication is appropriate, if there is a right underlying problem that we can say, okay, it can work with first line, typically with an ovulation problem.
Yeah. Okay, so my next one is, are my chances of conceiving with IVF much higher?
Yes. Yes. So it's again a very interesting question. And before I'm going to answer that question, I'm going to speak about natural fertility. Huh? Okay. So natural fertility is not very high. Huh? So if you look at a young couple, say they're both 25 years old, and there's no fertility problem. He's fine, she's fine, everything is okay. Tubes are fine, ovulation is fine. And the woman ovulates and have intercourse on that day. The chance of conception is not 100%. Huh? It's not guaranteed that she will be pregnant. It's also not 80%. It's not 50%. It's estimated to be around 25%. It's not high, huh? So human fertility is not that high. That's why we always say, if you have been trying to conceive for 2 months, I give an example, and there is no obvious problem, you mustn't do any tests, huh? Because very likely it's still going to work. Huh? And that's why we come back to the definition. If you have been trying to conceive for at least a year, and there is no obvious problem, yeah, there might be something, huh? Might be something going on. But even then, studies have shown that in couples who have not been successful after 1 year, that up to 80% will conceive within the next year without treatment. Just saying, huh? So the most common reason, if you're not pregnant after a few months, is that you've just had bad luck, huh? So human fertility is not very high, huh? It's not very high. Yeah. So then we ask, why are there so many kids in the world? It's because there is intercourse every month. And so, and if you take it month after month after month after month, then obviously there's a very good chance of conceiving. But then IVF, what is the success rate of IVF? That also depends. Huh? And the success rate of IVF depends on age and on what is the underlying problem. And we spoke about general health and all these things, but it's around 50% in good circumstances. That means we've got somebody with good quality eggs, who's not too old, under the age of 35, we've got top quality embryos, 50%. So it's double from natural. Huh? So it's a lot higher, because the egg is fertilized already. It has been grown for 5 days already, and then we put it inside uterus. So a stage further already than if you just try to conceive with sexual intercourse. So yes, the chance of conceiving with IVF is better, but then there's no reason to do IVF, huh? Because
that's correct.
in most cases, IVF is not necessary, because if you try to conceive spontaneously a little bit longer, it very often does work. So IVF is done for a medical reason. Huh?
Yeah.
If the tubes are blocked, that's the most common reason that we do. I mean, the most obvious reason to do IVF. Yeah. And the first IVF, now long time ago, was done for a lady with blocked fallopian tubes. Huh? So That is the classical indication for IVF. So it's done, IVF is done for a medical reason. We say there's an underlying problem, that's why we do IVF.
Okay, so the next one, I'm going to make this into one. We've only got 5 minutes left. How would you prepare a male and a female if you are about to do fertility treatments?
Same. A male and a female is not different. Huh?
Yeah.
They're the same. And I think we spoke already about that. So eat your fruits and veggies and do some exercise.
Yeah, the Mediterranean diet, eh?
Yeah, that is a good one. I think if you look at studies that have been done, then the Mediterranean diet is the most promising one for fertility.
Okay.
But general, a very healthy lifestyle is important. So studies, for instance, show that both males and females that have got consumption of 3 to 5 fruits per day and 4 consumptions of vegetables per day, they conceive a lot better than couples that don't do that. Huh? So there is no doubt about it, that eating healthy is very important if you try to conceive. So if you say you would like to have a baby, it's good to have that healthy lifestyle. Same with exercise. Huh? Yeah. So exercise is good for fertility. Huh? So when I was young, I'm still young, let me repeat, but anyway, there was a lot more emphasis on rest. Huh?
Yeah.
A lot more. Huh? Now it's a lot less, okay? And I wouldn't say that there are no forms of exercise that can be detrimental for fertility, huh? But then we go to real extreme exercise. Huh? I give an example like marathon runners or something like that. Huh? Okay.
Yeah.
And most of us don't do that. Huh? Most of us are, I mean, some of us are,
yeah,
but most of us don't. Huh? Yeah. So exercise, even quite serious exercise, is good for both male and female fertility. So I'm a cyclist, for instance, and it was always said that over years and years, cycling is bad for sperm. Huh?
Yeah.
Not true. Huh? We know now for sure that if men that cycle, their chance of fertility is better than for men that don't cycle. Huh? And why is that so? Because they are fit and healthy. Huh? So, and in the past it was said, no, you mustn't cycle and you must stop cycling. Still sometimes, but it's not true. Huh?
My husband's a cyclist, so I actually warned him about it.
Yeah,
he's also a cyclist.
It's still around. Huh? So
yeah,
it is important for both men and women to understand that exercise is good for fertility.
Yeah.
And let me repeat, there are some forms of extreme exercise that are, I mean, extreme is extreme. Huh?
Yeah.
But, and even in pregnant women, huh, it's for sure that if you have 30 minutes of moderate exercise per day, reduces the chance of pregnancy complications. So I say reduce the chance of pregnancy complications. Huh? Okay. And it's normal, because then your chance of developing things like high blood pressure or sugar is obviously less if you are in good health and if you're fit than if you don't do that. So the thing of rest, we have changed our approach a lot compared to a long time ago. So when we did IVF 30 years ago, then the patient had to stay in bed for 24 hours after IVF. So we did embryo transfer and to stay in bed. So we did the embryo transfer, and then the patient went immediately in a bed, and we put a note on the bed: please don't shake. I'm not joking. Huh? I'm serious.
Sure.
And then the bed was brought to the ward, and there the lady was not allowed to come out of the bed, and she was washed by the nurses in bed and everything like that. Okay. And obviously now we know it's not true. So now we do an embryo transfer and hope the ladies go home, and we do every half an hour we do an embryo transfer. Yeah. And again, that has been shown in studies is better, huh? The success is better if you do it like that than if you stay in bed for a whole day, huh?
Yeah, yeah.
Because your blood circulation is better, huh? So yeah. So a good health is important, and we speak about a healthy diet and about exercise, and in a general good health is important. And then it's okay to take a supplement. And for supplements, I always say you mustn't take too many supplements, huh? Because there is always, okay, the patients come to me and say, doctor, I take this and that and that and that and that and that, and it's all like a whole list. No, that's not a good idea. It's better to take one good quality supplement.
Yeah.
One good multivitamin that contains most of the things that your body needs, and that's it. Okay, both for males and females, because you can also overdose on vitamins. Huh? It's not impossible. And if you overdose on certain things, then it can also be harmful for your health and for your fertility. So it's also not good to take too many things. But yes, a good quality supplement can be beneficial for your general health and also for your fertility. And for women, the one that is important is folic acid, huh? Because we know folic acid or folate, it's important to reduce the chance of having abnormal children.
Okay.
Like spina bifida, okay, that's the most common one, but that's important. So we say if you try to conceive, make sure you are on your folic acid from the moment that you try to have a baby, or even from before that. That's the ideal way.
Okay. The last question, doctor, and I've only got 2 minutes for you. Sorry.
Oh, no.
Any words of advice to couples considering fertility treatments or those who will be undergoing the treatment soon?
Yeah. The best advice that I can give, actually, I was speaking to one of my colleagues about it today. It's that this is not an easy thing, huh? Infertility treatment. And it's not, infertility treatment is very different from other types of treatment. So if you got an appendicitis, huh? So you've got pain there on the right-hand side in your lower abdomen, and you feel sick. Now you go to the doctor say, okay, think you've got an appendix. The doctor calls the surgeon, say, I've got Mr. or Mrs. So-and-so, can you please check for an appendix? Then the patient is seen by the surgeon. They go to theater the same day. They go home after a day or 2 days, and after 2 weeks, they're fine. It's always like that. It's very predictable. Huh?
Yeah.
And fertility treatment is not. Okay, it's absolutely unpredictable. So you can have a couple coming in your office. You can say, okay, this is what is going on. You do then and that, poof, next month you see them pregnant.
Yeah.
And you can have another couple coming in your office, same problem, same diagnosis, same treatment. You do this and this. 2 years later, still not pregnant. So this is, I think, is the most difficult, and it's not always an easy thing to understand that fertility treatment is stressful and a bit of unpredictable. So, and that's the same thing with natural fertility. Yeah? I say, okay, if you try to conceive and you're not pregnant after a month, it's normal. Huh? If you're not pregnant after 6 months, it's probably still normal. I mean, there's a chance that something is wrong, but there's still a good chance you have just had bad luck. Huh? Okay, so it's a stressful thing because it's unpredictable. So the best advice and the best understanding you can have is say, you must hang in there, huh? And have some patience sometimes and say, okay, we must persist. And I mean, maybe I'm going to end with a quote now, because they say, if you persist in madness, that's the definition of sanity. Huh? But I mean, yeah, if you persist in madness, you must persist in the madness if you do fertility treatment. Yeah. So if you keep on doing the same thing, huh? Keep on doing the same thing and you're expecting a different result, that's exactly what you must do with IVF or with fertility treatment. You give fertility drugs, you're not pregnant this month. That's okay. You give fertility drugs, next month, you're not pregnant. The third month, you're pregnant. Yay.
Yes.
And you have done 3 months after each other exactly the same thing. So
persist in the madness.
Yeah.
Persist in the madness. Thank you very much, doctor. I hate cutting you off, but I've got another talk at 3:30 now. And thank you
at
for
3:30. Oh dear, yes, yeah.
Yes. So thank you very much for joining us, and it's always a pleasure having you on board.
It's such a pleasure to talk with you, Leanne. Yeah.
It's a pleasure. Have a great day. Thank you very much, doctor. Bye.
Take care. Bye.
Bye. So guys, we just have one more winner. Well, we got a winner, and it would be Wasfika Davids. Wasfika, I'm sorry, I'm rushing now, but you've won a month's supply of Insomax Q. That's from me. I'm giving it to you. Please email me or WhatsApp me, info@fertilitysolutions.co.za, and I'll arrange to get it to you. So for Wasfika, David, you have one month supply of Insamax Q. Thanks, guys, and we'll check you over on our Real Women Real Stories on on Instagram now at 3:30. Thanks. Bye.